is transmitted by contact from skin to skin to skin. One simple example is when you kiss your lover on an infected area. So, let's jump into the details and remember that even though we are not doctors, we can still direct you to the resources and answers needed. What is the definition of herpes? Well, the herpes virus is classified as a sexually transmitted infection, and that's why we often call it genital herpes, and it often appears in the forms of blisters. There are two types of genital herpes. First, there is HSV1, which is generally located on the mouth and can sometimes be transmitted to the genitals and or anus. Then there is the HVS2 type, which is usually located in the anal and genital area and very rarely on the mouth. Note that a co-infection of types 1 and 2 is quite possible. It's also important to note that many people live with herpes. In fact, 67% of the world's population under the age of 50 lives with herpes type 1, according to the WHO. So please remember that you are not alone at all. You are not alone. You are not alone. But what are the symptoms, you may ask? Well, it's possible to live with herpes and not have any symptoms. The symptoms can vary a lot from person to person. Symptoms include blisters, lesions, individually or in clusters, anywhere in the area of the genitals or anus. These blisters crust over and heal within 1 or 2 weeks. Other symptoms are also possible, such as fever, muscle ache, burning skin. Note that these symptoms are common and may be associated with other things. Symptoms may decrease in intensity over time. They are especially intense and painful during the primary infection known as the initial episode. Other factors such as stress, anxiety, colds, and flu can reactivate the virus. Even if there is no curative treatment for the moment, several strategies can help avoid the appearance of reoccurrences, meaning the reactivation of the virus, such as medication, stress management, healthy diet, and so forth. So you may ask, what is the transmission? For there to be a transmission, two conditions are necessary. The first is to have an area where the virus is active. The second is to have an entry point, such as lesion, small wound, mucous membrane. So don't worry, talking about the risk of transmission does not automatically mean transmission. But now that we took a look at the transmission, how do you detect it? Well, the only way to know for sure whether or not you have genital herpes is to get it tested, as simple as that. A doctor or nurse can do the test, and the test involves taking a swab of the fluids from a sore. Blood tests can also determine if someone has a herpes infection, but they are not able to determine whether it is an oral or genital infection. This test can only detect antibodies to the virus type 1, or type 2. It can determine your type of herpes, but not the region of your body where it is located. For example, if you're positive for herpes type 1, you will not be able to know if it is located on the oral or genital level. The results are therefore difficult to interpret and can be very stressful. However, there are very good news, and the good news is that taking suppressive drug treatment reduces the recurrences in asymptomatic shedding. The risk of transmission to the partner therefore falls to 1.1% of the time in the year. As you have noticed, when you learn more about the virus, your knowledge helps you live better with it, because you can adapt better strategies for preventing and managing the virus. So remember that most of the time, herpes is not life-threatening. Of course, with some rare exceptions for immunocompromised people or for babies during childbirth if there is no medical follow-up. So, now that you know a little bit more about herpes, I hope you enjoyed this video, and I hope you enjoy learning about herpes through the lens of ASMR. If you want to learn more about other things, let us know in the comments below, and stay tuned for more. Make sure to subscribe